Hi, I'm Dr. Karthik Gunasekaran, Director of Metromale Clinic and Fertility Center in T Nagar. I'm an andrologist, embryologist and sexual medicine specialist. My topic for today is going to be about sperm mapping, and I'm going to explain the procedure of sperm mapping to you. Now, if you've seen my previous videos, you know that sperm mapping is a procedure that is done for Azoospermia to find out the location of sperms in the testis. Now, usually people are subjected to testicular biopsy. You know that a testicular biopsy can be painful because tissue is extracted from the testis in multiple locations. Now, for a sperm map, in the US at least, when I trained with Dr. Paul Turek, the procedure was usually done under local spermatic cord block. But after I came back to India and started practicing the same here, I found that a lot of people had anxiety and were quite restless when this was done under a local cord block. So what we started doing here at Metromale Clinic and Fertility Center is that we started performing this procedure either as a short general anesthetic procedure or under regional anesthesia. Now the procedure usually is done as day care. The patient typically has to stay for about 5 to 6 hours. The procedure involves, after the anesthesia, subjecting the testis to bilateral needle aspirations. So based on the size of the testis, the number of aspirations differ. Now if it's a very small testis, it could be as low as 14 to 18. In a larger testis, it could go up to 36. You have to understand only a 22 or a 23 gauge needle is used. So the amount of trauma to the testis is very minimal. There are no cuts, no incisions at all. And the entire procedure takes only about 15 to 20 minutes to do. And immediately after the procedure, the patient is just given a couple of ice packs and sent to the ward. Now, during the procedure, when the specimen is taken, we take only cells. We do not take any tissue. So, because we don't take any tissue, the trauma to the testis is minimized. We stain the cells, and these cells from the slide are then sent to a cytologist to look for sperms. So, we are looking for either immature sperms, spermatocytes, spermatids, secondary spermatids, and mature spermatozoa. Now, so the results typically take about 4 to 6 weeks to come. So the cytologist looks at these slides, send them back to me, and both of us have to concur as to where the sperms are located. So once we both agree on the location of the sperms, the results are charted out, and then we have a discussion with the patient. Now when these patients are followed up over a period of time with serial ultrasounds concerning damage to the testis, when compared with testicular biopsies, the amount of trauma that the testis suffers is really very minimal. So a sperm mapping procedure for azoospermia is really very advantageous over a testicular biopsy.